Hi there, it's Dr. Jason Lichten of Central Ohio Plastic Surgery. I'm board certified in plastic surgery and the founder and director of Central Ohio Plastic Surgery with offices in Columbus and Lancaster, Ohio. Today we're going to talk about the difference between a tummy tuck and liposuction for treating the abdomen, midsection, and waist. It's very common patients will come to me after having children, being done having children, and wanting to get their body back to that pre-pregnancy shape. The question always starts with, do I need to do a tummy tuck or liposuction, and which one is right for me? Well, when we talk about abdominal contour, there's really three things that go into it. How loose the skin is, how loose the muscles are, and how much extra subcutaneous tissue or fat is there in the abdomen. Whether you're talking about a tummy tuck or a liposuction, ideally you should be at or near your goal weight. Neither surgery is a great weight loss option. Most of the time it is all about contouring and how we balance your midsection to your top and your thighs so that things feel proportioned. Now, there's basically skin, muscle, and fat which go into the shape of your abdomen. When we talk about loose skin and loose muscle, tummy tuck is by far the best option that there is surgically to treat those areas. There are other devices out there, radio frequency or muscle tightening devices that will create some tightening in these areas, but not the result of what we can do surgically, and certainly not getting you back to that full mommy makeover type rejuvenation of your waist. When it comes to subcutaneous tissue and fat, areas of the lower portion of the abdomen can be excised along with the skin that's removed during a tummy tuck, but in general, if it's just extra fat and sort of feels a little bit more round in the area without a lot of loose or hanging skin, then that may be an area that we can treat with liposuction. Now with liposuction, there's a bunch of different options out there and different ways we can do it. Most of the time, people are using suction-assisted lipectomy, power-assisted lipectomy, or tumescent type. Essentially, we're using a small cannula through small incisions to remove the fat directly from the area. We can also use ultrasonic, laser energy. There's other ways to help liquefy and melt the fat. But in general, liposuction is someone whose skin feels relatively tight, muscles are not very separated, so typically not something someone who has had multiple pregnancies or twins or triplets. That actually creates a little bit more spread of the muscles, leading more towards the idea of a tummy tuck. For most women or most patients who've lost a fair amount of weight or had that fluctuation in weight either through bariatric surgery, diet, exercise, Ozempic and other weight loss means, or the fluctuations and changes in weight that you get from pregnancy, that loose skin typically should be removed with a tummy tuck. Now, the incision from a tummy tuck is a bigger incision that goes usually in the waistline, covered by underwear or a bathing suit, but goes basically from hip to hip, along with a small cut around the belly button so that that comes out in a normal anatomic shape. Most of the time, if you've had kids, tummy tuck is usually going to be a better option, but one of the benefits of seeing a board certified plastic surgeon like myself is we can give you the options. It can be a tummy tuck, it can be liposuction, it can be cool sculpting, it can be radio frequency, all sorts of different options that we have, but at your consultation, we'll review what your options are and tailor a plan that meets your specific needs.